Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome back to another episode of the Sacred Medicine Podcast. I am your host, Margaret Romero, and today's guest is Dr. Ralph Esposito. He has been on the show before. We will add show note links to that. He is a naturopathic physician, as well as a licensed acupuncturist and functional medicine practitioner who specializes in integrative urology and men's health. He currently is practicing at the Center of Excellence in Generative Medicine with Dr. Peter Diadamo, and currently also conducts research at the NYU Smilo Integrative and Functional Urology Center with Dr. Gio Espinoza. So I'm really happy that he's in today because we are talking about erectile dysfunction. And this may or may not be an issue in your life, but if it is, there's a lot of things that we talk about today. So one of the things is how to approach your man if this is a real issue, or if it's been an issue for you, but you haven't really brought it up. So we talk about how to bring it up because it can be a little bit of a touchy subject. Then we talk about all the different ways that you can treat this, either through different types of prescription medication and natural supplementations as well, which is really great. We also talk about why pot isn't good for erectile dysfunction, how that could actually be causing an issue there, and all other kinds of really juicy tidbits. So I hope you enjoy this, and on to the show. Hello and welcome back to another episode of the Sacred Medicine Podcast. I am happy to have Dr. Ralph Esposito again on the podcast talking about erectile dysfunction. Welcome, Dr. Esposito. Welcome back.
Thank you very much. It's a pleasure to be back. And I guess that's a good thing because I guess people like to hear what I have to say.
Yeah, I have a really interesting topic. And this is a topic that actually girlfriends for some reason come to me a lot with, and I'm not really sure why I necessarily have all of the answers, but I guess they feel comfortable enough to talk. I mean, I am very open about talking about all things,
right?
Sensual and sexual. So that may be one of the biggest reasons. And I think that this is a pretty big topic and maybe something that a lot of women don't even really talk about. So why don't can you just first tell the listeners what exactly is erectile dysfunction? What does that mean exactly?
Okay, so erectile dysfunction is typically when a man is unable to maintain an erection enough to have to penetrate for sexual intercourse. Now, this applies to heterosexuals and homosexuals as well. A lot of people think that it's just like a heterosexual thing where a man can't penetrate the vagina and, automatically it's erectile dysfunction, but also for people who are homosexual or bisexual or however they prefer to call it, it also impacts them as well in that they are unable to have intercourse. There's many different types of intercourse, but they can't have sex because they just aren't able to have an erection. And there's a lot of scores a lot of surveys that are used to grade what a man's erectile issues are. There's a SHIM score, and there's the ADAM score, which is for aging men. So those are a few different surveys that we use to identify if a man has ED or not.
Now, if a man starts out fine, but then sort of loses the erection, is that also considered erectile dysfunction, correct?
Yes, yes, it is. And again, there's a sexual health inventory for men where they can see if they have, these symptoms. And it asks, like, are you okay to maintain an erection? Do you lose an erection? Do you feel confident in having an erection? So that would be considered erectile dysfunction. So they could start off for the first 5 minutes or so and then kind of just lose it, and that would be considered ED.
And when a man has premature ejaculation, is that still considered erectile dysfunction or no?
No, that premature ejaculation is a completely different animal.
Different thing. Okay.
Yeah, a lot of men think that they have premature ejaculation if they just can't, if they can't hold it, or if they ejaculate after like 2 minutes. Well, that's not technically premature ejaculation. Premature ejaculation is usually when, I believe it's like less than a minute, or it might even be 30 seconds. I don't know exactly what the time frame is, but that's premature ejaculation. Erectile dysfunction is completely different. It's where they can't even get to the point to ejaculate.
Okay. Got it. Just wanted to clarify that. So what do you think is the biggest reason for men? And I know it happens to men of all ages. And
Right.
So, and obviously there are different reasons for all these, within all of these age groups, would you say?
Right.
Or, yeah?
Yeah. So this is something that a lot of men are a little bit, they come to see me, and this is something that I'm a little bit disappointed in the research, is that a lot of the research discusses erectile dysfunction. Usually, it's like an old man's disease. They see it as above the age of 50 or sometimes 40, but I'm seeing it much more commonly now in men who are in their 20s. I have some teenagers who have opened up and mentioned that they've been experiencing this, although, they confide in me with their parents outside of the room, and then they explain they're 17 or 18 years old, and like, hey, I tried having sex with my girlfriend and it didn't work. So I've seen it in as young as 16 years old all the way up to men in their 70s and 80s. So it's not an old man's disease at all. And it's upsetting that a lot of the research is not putting this out, because then men realize, and they go online and they're reading, anecdotal reports of men saying that they have this problem, but then the research is not really fully on par yet. So I see it; it exists, and I would say it happens a lot more in younger men than the evidence or research would say.
Okay. And what are the biggest reasons why men experience this?
So there's two types of erectile dysfunction. There's we call it endothelial or vascular, where basically there's not enough blood flow. And then there's psychological, so psychogenic, where it's a psychological aspect, psychosomatic, where the mind is impacting the body. And then there's mixed. So they might have an organic vascular issue and psychological aspect, and it's just, it's both of them. I've seen a lot of erectile dysfunction to be caused by the psychological aspect, the men psyching themselves out, getting nervous, being overworked. Come on. That we live in a society, and, being from New York, it's the go, go, go type of lifestyle, right?
Right.
Where it's, can't stop, won't stop type of lifestyle. And that takes a toll on a man. And, when they want to settle down and relax, they can't. And that's where I see it most often.
So when men experience this, let's say they're in their early 20s and they have an experience, would you normally see it when somebody is with somebody that's new, like a new relationship, or a man that's just starting to have sex? Do you see that? Is that very common to happen?
That's a good question. That's a very good question. And there's no rhyme or reason that I've seen so far. I've seen it occur in men where they're with a new partner and they're just not comfortable, and they don't feel comfortable with that partner, and they just can't get that connection, and they have issues having an erection. And then there's relationships that have been going on for too long, longer than they should have, and there's a lot of animosity and anger and frustration among them, and then that impacts their their the man's libido or his sex drive or things like that. So I've seen it happen in both aspects. I will say though that one thing is very interesting, that vacation. So if a new couple, like they've been together for less than a year, they had an issue, but with having an erection, and then, or he had an issue with having an erection, um, and then they go on vacation, for a week or so on vacation, they feel great and everything's fine. And same thing with an older couple or a couple that's been together for a longer time. They go on vacation and things are fine, and they get back to life, and the issues start again. That's something that I've seen pretty often occur pretty often.
Is that just the stress from being at home?
Yeah, yeah, it is, and it's a lot of people say, "Oh no, there's definitely lifestyle. Your house is toxic, or you're living in New York City, so the stress of New York City." But I think it's the reminder. It's the Pavlovian type of thing. It's like, I'm home. I'm stressed. I'm stressed. I'm in sympathetic. I can't relax. I have no parasympathetic. The
Right.
relaxed nervous system going on. And that's what I really think it is that when they're in a different setting, hotels, they do a great job at making you feel comfortable. And if
That's
you're at a
true.
resort and such, I mean, you know it yourself. When you go to a resort, like, I've even seen people's like IBS go away, and even certain bowel issues and things like that. When they're on vacation, those things go away, and it has a lot to do with the psychological aspect.
Yeah, so interesting because yeah, you're not coming home and doing, cleaning the house or have a long day at
Right,
work or coming back from a really long commute. You're just relaxing on the beach or having a cocktail and finally just being able
right,
to spend really great one-on-one time with that person rather than like a quick hello, or at the end of the
right.
day, you're like, are you kidding me, right? You want me to do what?
All right, take out the garbage. Do this. Go get the diapers. We need milk. Right, that type of stuff.
Exactly.
And it's funny that you mentioned that, because when you're on vacation, you have a cocktail, and or I mean, wine is great for sexual health. Kind of like a natural aphrodisiac, but also has a lot of nutrients in there that are helpful in moderate amounts, of course. But when you are on vacation, you have a cocktail or you have a glass of wine to relax and enjoy each other. When you're home, you have a cocktail, scotch on the rocks, or a glass of wine, sometimes a bottle of wine, just so that you can numb the tough day, right? So it creates this big disconnect between your body and your mind, and you're relaxing. You're doing the same thing, but it's having a completely different effect.
Mm, true, true. Very true.
It happens.
So, what are some of the things that I know you're going to go and talk about some of the treatments for this?
Yeah.
And you've got several different things that people can do. Now, before we jump into treatments, let's just talk about how women approach this with their man. Because I have primarily women listeners, and this is a really, I think when we talk about a man's penis, I think it's a really
Mhm.
touchy subject for men. They don't want
Oh
to
yeah.
know that there's something wrong.
Right.
And they get really
Defensive.
embarrassed. And yes. So, how can a woman bring this up? Because, I mean, we can talk about the different ways. I have a personal experience, but we won't go into that just yet. But what's a good way? I mean, how can you talk to your man and just, if he's having an issue? Because
Right.
sometimes, it happens, of course, it happens. And maybe, it happening once or twice or just really randomly is not a big deal. But if it's happening really consistently, like there's a problem.
Right. So one thing that I want all your women listeners to think, when he says it's not you, it's me, he means it. And if you find that you're in a relationship where you two are genuinely connected and in love, a lot of the times it is not you. And a lot of women take it personally. Wow, I mean, am I not sexy enough to arouse him?
Right.
Am I doing something wrong? Am I hurting him? Am I too rough? Am I too soft? Am I not, um, you know, hitting his sweet spot. I mean, there's a lot of things
Right.
that women go through. It's like, oh, they take blame for it. Well, then
Right.
that creates more stress because then he's like, no, it's not you. And then the women they begin to take an offense, and they're like, well, what can I do to make it better? And then they try harder, and then he tries harder to get an erection because she's trying harder to please him, and it's just like this cycle where you're trying really hard to get to something that you're not even identifying the underlying cause. So for women to approach their men, what you need to understand is that number one, it's not you. Most of the time, it's not you. And if it is you, you would know that you both are not happy, and it's just not a connection. When you do approach your man about this, the best way to do it is, I would say, is to get him to a physician who actually he can open up with, because a lot of men will not go to the doctor to discuss this.
Right.
They kind of are embarrassed for it. But I usually find that men, you won't go to the doctor for high blood pressure, but when their penis stops working, they probably want to go to the doctor.
Right.
So, I mean, that's just how it works, right? Because that's kind of like a primitive type of thing. So one thing I would tell your women listeners is, try to get your guy to a doctor who kind of understands, that they can connect with, and that he finds a connection with. That's not easy to find. And there's not a lot of functional medicine practitioners or naturopaths or holistic practitioners that are specializing in this area.
Right.
So if that's not the case, then you need to talk with him and say, well, you don't even have to address the actual issue. Don't say like, let's do this for your erectile dysfunction. No, don't say that. Say, no, really, because that's what they'll say. They're like, oh, well, we'll go get this over the counter and we'll go bring you to this expert for your erectile dysfunction. No, what you need to say is like, let's do things that we can relax more together. Let's go for a couples massage. Let's go to a spa and have like a jacuzzi or something like that, where you have a massage and you have facial and things like that. Or let's go for a walk together. A walk is actually very relaxing, can help lower cortisol levels. Some people find, acupuncture to be helpful. So a lot of women are more involved in their healthcare. So try to say, hey, I'm going to the gym, and after the gym, we go in the sauna. Why don't you go to the gym too? And don't even say for your erectile dysfunction, say, I think you'll feel better. And you notice that once you start treating the body and not the actual symptom or the disease, then the other things tend to resolve. So focus on the relaxation part. Let's go to a baseball game. It's summer. It's summer now. So let's go to a Met game or a Yankee game, or just do fun things. And the other things typically tend to resolve, because ED is a symptom. It's obviously it's diagnosed as a disease, but it's a symptom of an underlying issue. So treat the underlying issue.
And the majority of where it's stemming from is either high stress, or it's all what you mentioned before. There's only two reasons. They're the vascular, the
Right.
decrease in the blood flow, or it's kind of a psychosomatic thing. So would you say the majority of the reason is really not, if a guy's somewhere between the age of like 25 and 40,
Yep.
is it a vascular blood flow issue at that age?
Usually not, unless the person is obese.
Okay.
Metabolic syndrome is a cause for ED on its own. High estrogen levels are going to be can desensitize. It's funny that you mentioned this. This is just coming up. A lot of men in their 20s and 30s, now that the society is more open to cannabis or marijuana, it's a little bit more accepted. And I know a lot of people that I grew up with. They used to smoke weed all the time. And I spoke to one of my mentors, Peter Diadamo, and he was like, you should look at the connection between ED and marijuana smoking, because I find a lot of these guys who are stressed out, they're smoking weed a lot to help them relax, but they still actually have the erectile issues. And there's actually some mechanism saying that THC can actually inhibit erections because it binds to receptors on the tissue in the penis and prevent it from actually having an erection.
Interesting.
Yeah, really cool stuff.
Yeah, really cool.
So that's just on a side note, because obviously people do that for relaxation and such.
Right.
But the vascular part, if that's usually more in older men, and then that's when it becomes a cardiovascular issue. The penis is a measure of a man's health, in my opinion, because it could tell you a lot about the endocrine issues. It could tell you a lot about the cardiovascular issues. It could tell you a lot about the nervous system issues. It could tell you about the psychological aspect because it's all connected.
Right.
So, look at the cardiovascular health there if somebody's a little bit older, but if they're younger, I would say more of a psychological or stress aspect to it.
Okay. All right.
Sorry,
so
went off on a tangent there.
No, that's great. That's great. I love that. Are there a ton of studies about the THC, the use of cannabis?
I posted something on my Instagram recently about it, and I think I have about 3. There's one big meta review which has about 5 to 10 studies connecting the two, not just ED, but also just sexual dysfunction or decreased orgasm as well. But there's about 2 major studies connecting THC to erectile dysfunction.
Okay. All right. And so just going back to my personal, this happened a long time ago. I'm going to say late 20s.
Okay.
Actually, it was an ED.
It was not?
No, it was premature ejaculation.
Oh, okay.
It was becoming a really big problem for me. And he went to see a doctor. He went to see a urologist, actually. And they gave him some pills. I think they gave him a beta blocker. Does that sound right? Does that sound right?
They usually use beta blockers, or sometimes they use SSRIs or antidepressants.
No, they didn't use that.
Okay.
And I think that it was, we're talking about ED. We're not talking about premature ejaculation, but because I brought it up before, the story ends like this. He went and we broke up. I broke up with him because I couldn't even deal anymore. It was that bad. And I don't know how much time passed. Maybe a month. Comes back, says he went to urologist. Great. Okay, so we started hanging out again. And then he bought some book, like the Multi-Orgasmic Man, and they were talking about how to not have premature ejaculations. And it just didn't work out. It seemed like he was really thinking about it the whole time and really focused and really forcing it not to, happen. And it didn't feel, it felt fine at the time, but he seemed like he was putting so much effort. It just, an extreme amount of effort to please me. And it just, the end result was I still was not as satisfied. So
how long, I don't mean to ask details, but
that's fine
because we are on the topic, did he last less than a minute?
Initially?
Yeah.
I would maybe say 2 minutes.
Okay.
Or, if something like that. And then afterwards, after he went to see a doctor and was on medication and read the book and he was practicing, I guess. I don't know what he was doing for the month. And so it was better, but it wasn't it
wasn't natural.
Right. Yes, exactly.
Too much
It wasn't
intention.
natural. It was there was so much I couldn't even keep my eyes open because watching him having he seemed stressed and really focused. And that did not turn me on.
It was that's how men are though, right? A lot of my men patients, they want to see numbers, they want to see results. And it's the goal for sex in men is to please the woman. And that's where they lose it, is that it's not just to please the woman, it's enjoy the process.
Mm-hmm.
And that's what he was doing. He was not enjoying the process. He was just trying to please you, which is not a bad thing, but he just wasn't doing it the right way.
Yes. So that was the end. So that was the end of that relationship.
Poor guy. But you know what? That happens a lot, and a lot of men, they try to put this effort in, and they try really, really hard, and that's what happens with a lot of these drugs, a lot of these erectile dysfunction drugs. Have you ever seen patients come to you and seek those drugs, or do you prescribe them, or do you use them?
For erectile dysfunction?
Yeah, like the Viagra or Cialis.
Yes, for sure.
Okay. And, what I see in a lot of these men is, so erectile dysfunction, a lot of people think, okay, well, then just give testosterone because testosterone is like the man hormone. And
Right.
if you don't have an erection, then you're not a man. And that means you need more of the testosterone. Well, not necessarily. What's actually happening is that men who are taking these erectile dysfunction drugs, they are taking the PDE5 or phosphodiesterase 5 inhibitors. And they're having an erection, which is great. Sometimes, hopefully, not longer than 4 hours. But it does happen. It certainly does happen.
Mm-hmm.
But they're taking these drugs and they're content with their erections, but their mood is not there. So, they're having an erection, but they don't actually have the sex drive. So they have sex, then it's fine and they do whatever, but they're just not into it. And as kind of you were mentioning, the intention was with your ex was to what didn't feel natural. That's what happens a lot with these ED drugs, is that the connection there is not natural because their penis is working, but their mind is not in the same place, and they get a little bit disconnected from their penis, where it's like, okay, I have this guy who's erect and he's hard, but I don't really feel like doing this, and that's where low libido comes into play, and that's where testosterone comes into play as well, because testosterone is in men very different than women, which you may attest to. You're that expert. But in men, testosterone actually can increase erections and increase libido, but it doesn't always solve that problem. But a lot of men, when they have the erectile issue and they just don't feel like having sex, then it really doesn't do much for them.
Now, can you use Viagra or Cialis for someone that is having maybe not an issue with vascular flow, blood flow, but it's more of a psychological thing? And then they're like, oh yeah, okay, here we go. Got the erection. This is good. And then it becomes natural. Can they start to develop confidence after a little while of maybe being on that and then not stay on it?
Yeah, I'm so happy you brought that up. Yeah, you can use it as a confidence booster. I don't prescribe those drugs, but men who are taking them, their urologist would dose it at like 100 milligrams of Viagra, and that's really high, especially for somebody who's having a psychological aspect or a psychogenic ED issue. So I would tell them, talk to your physician who prescribed it. You may want to take a lower dose, and you dose it to a low amount of dose where it has some effect, but there's a placebo effect there. I mean, I don't care what you say as well. If you take something and you believe that it's going to help you,
Right.
and it helps, then you're going to believe it's going to help you every single time.
Mm-hmm.
So yeah, absolutely. It certainly is a confidence booster for a lot of men. They'll take it one time and they're like, oh yeah, I got this. And then they'll take it, they'll miss out on it the second time, but notice that they were a little bit better. And then they'll take it a third time and say, oh yeah, this works. And then eventually they kind of get off of it. But you get them to a dose where it's so low. I mean, even like 25 milligrams might even work in men, because if their vascular system is working, the drug is going to work
Right.
very well.
Exactly. Yeah. Okay, cool. So let's talk about some of the things that men can use that are, let's look at the natural things.
Yeah. So that's kind of where I have a big interest in, and that's where kind of I have my bread and butter, where a lot of men who actually, Viagra is expensive. I think it's about $60 a pill. It's soon to be.
Is it really? Is it that much?
Oh yeah, it's like $40 to $60 a pill.
Wow.
And yeah, it's not generic yet. I think that's going to happen this summer or next summer. So it's going to drop in price very soon, but it's pretty expensive. And a lot of insurance companies won't cover it. Actually, funny story, I had a friend from Seattle. She messaged me and she's like, hey, I have this guy, he has ED, and he wants to take Viagra. And I was like, okay. She wanted to know how to properly dose it. And I was like, okay, you should try it this way. I told her to start low, and his insurance denied it because Viagra was initially used for pulmonary hypertension. And he didn't have pulmonary hypertension, so he didn't get it approved. So then we had to go to a more natural approach. So the things that I told her, I said, okay, well, first we need to figure out, is it psychological or is it vascular? And she thought it was more of a vascular thing. So I said, okay, well, the first few things you should try are something called citrulline. Citrulline, a lot of, I don't know, do you use citrulline or arginine often?
I use it some. I don't use it all the time, but yes.
Okay. So it's used to increase nitric oxide, which is basically it increases allows your blood vessels to dilate a little bit. They get bigger, more blood flow, and it's pretty targeted to the penis area. I mean, the whole body, but it works well on the penis area, or the pelvic area, I should say. Citrulline is a precursor to arginine, so arginine works well, and that's what a lot of these supplement companies are promoting, but it only lasts about 3 hours. So unless you take it 3 hours right before intercourse, it might not work very well. So I tell people to do citrulline, and they could take that, in the morning and evening, and it usually lasts a little bit longer. So that's a really good supplement. That's an amino acid, and it's fairly safe as well. The other thing that I like to use is another thing called epimedium, or as a lot of people see it in like gas stations and health food stores, like horny goatweed.
Yeah.
And yeah, right. So actually, a funny story is that actually works very similarly to Viagra. It is actually a PDE5 inhibitor. So it works very similar to Viagra. It helps increase nitric oxide levels, but the dosing has to be a little bit higher. And these studies on that have been in animals, so there really haven't been human trials confirming that. But clinically, I see it work pretty well. So those are my two big vascular support ingredients. And then another one would be resveratrol and pomegranate. So pomegranate is great. I mean, you could even use like pomegranate juice, and that also increases nitric oxide. But with resveratrol, they actually can repair the blood vessels. So it actually is a healing process. So it's not just dilating, it's actually dilating and healing, which is really what we want. We want a long-term solution.
Right.
Because I don't want people to be on this stuff forever. It gets costly after a while. And then, when my favorite, I'm sure you've used this all the time, is rhodiola. Right. Yeah, so that's great for the psychological aspect. That helps men kind of calm down and relax their nervous system. I use those in combination, and then I also use another herb called ashwagandha or withania, which is phenomenal for helping men just calm down and relax. And withania actually can increase testosterone levels as well. So we kind of hit it from all different aspects and try to get the most beneficial effect. And vascular and psychological. And I find acupuncture to be very, very effective, and it works a lot quicker than these herbs. Usually 2 or 3 treatments, and they're noticing a difference with the acupuncture.
Oh, nice. Okay.
Yeah, I love that approach. So you hit it from all different angles. You use a variety of different aspects, and you kind of try to calm it down. And then, you do lifestyle things, right? The exercise, yoga. Yoga is great. Yoga exercise or yoga, whatever type you do, can actually help loosen the pelvic muscles and, make you feel more comfortable and loose down there. So that's, obviously every person's individual, but that's a pretty effective way.
Now, have you heard of Caverject?
Caverject?
Caverject.
No.
Oh, Caverject is it's a prescription. It's an injection that is injected. The man injects into his penis before he's ready to have sex.
Oh, no, that one, I must have skipped that one. Okay.
Yeah, it's, I know that it's effective, but I couldn't imagine if I were a man that I'd want to stick a needle in my penis.
Yeah, I'm
it's and it's something that it actually has been used for Men who are over 60 typically and
Wow.
have issues. I don't
But
really see young men doing these or giving themselves this. And this isn't something I have prescribed this in the past, but this is not common for me to prescribe, though I have. Because a lot of men don't want to inject their penis.
yeah,
That's right. The thought of it, right, is
and
just
if you miss something,
right. So, I was just curious about, well, what about, let me see. There's one thing I wanted to ask also about when we're talking about erectile dysfunction. Same applies for men who are, like, what's the deal with men who can't get fully hard?
so it's not a complete, like they can penetrate, but it doesn't feel hard enough.
It's not 100%. It's like 80%.
Yeah. That is usually a vascular aspect there. That's where I think, okay, maybe there's some type of vascular blockage going on. Um, that also happens. I mean, it depends on how much you're turned on, right? And it's really hard to say exactly what the cause is, like why not 100%, why only 80%. That's kind of a normal thing, though. Erectile dysfunction is when you can't penetrate at all. But 80%, if it allows you to penetrate, ejaculate, and actually enjoy the experience, that's not technically considered erectile dysfunction.
Okay.
And that actually happens. I don't want to call it normal, but it's common, and it happens in a lot of men. And they don't usually complain about it, but a lot of women can definitely tell the difference.
Yes.
And then, okay, I guess we got your answer. So yeah, a lot of times women won't tell their man though. And he'll
Right.
be like, "Oh man, I hope she doesn't feel this. I hope she doesn't feel this," but she
Right.
probably does. And a lot of times that just could be a vascular thing. But I just see that men who are just like really overtired.
Oh,
And
okay.
they have the libido, they have the drive, but it's kind of like you're out of shape and you can't finish your 3 mile run, and
Got it.
you just die out. But usually when that happens, they start off pretty hard and erect, and
Yeah.
then it kind of slows down,
Yeah.
and then that is when you need to get creative and do things that kind of arouse each other better, and try to figure out what it takes to get him going. And that's when usually you can solve that problem, because sometimes it can, I mean, a lot of people tell you, that it can get boring, and that's where the creative part of it comes into play, where you need to change it up a little bit. And that's what I usually see a lot of couples do, or do more foreplay.
Got it. Got
Pep
it.
them up.
Or the guy could just be really exhausted at the end of the day.
That could be it too. And again, a lot of these things go away when they're on vacation,
I was just going to say, yeah, exactly.
right? Because you have time to rest.
Now, let's talk a little bit about testosterone.
Yes.
Because I know that sometimes a lot of people may think, well, we'll just give them some testosterone. Or, levels are maybe a little low.
Uh-huh.
But that may not always be the best approach for all men, obviously, because there are just reasons why you shouldn't. So,
Right.
do you want to talk a little bit about that?
Yes, I do. So, there's a very big trend right now in hormone replacement therapy where a lot of men are getting testosterone injections because their
Yes.
testosterone levels are low.
Yes.
That's fine. I have no problem with it if the levels are actually low. Now, this is where it becomes tricky. It doesn't completely solve the problem of erectile dysfunction. Not all the time. A lot of the time it does, but actually, I wouldn't say a lot of the time. Some of the time it does, but some of the time it does not. And there are some studies showing that, even when you give these androgen gels or the shots, that doesn't resolve the erectile dysfunction issues. Now, a lot of men who are in their 20s and 30s, whether they take testosterone from their doctor or from their doctor in the gym, the guys who's just supplying them with testosterone shots or whatever it is, it can lead to issues. Number one, when they stop the testosterone, they completely plummet. So then it makes it even harder for them to have erectile function. And then also that can lead to fertility issues. So, if a guy is taking testosterone in his 20s and 30s, testosterone turns off. I mean, any man who took testosterone will tell you that when they take testosterone, their testicles shrink.
Yes.
Right? So I'm not sure if you've experienced that firsthand or from patients, but it happens and it's common.
Clinically.
Yeah, happens all the time. So that can be a problem with men who are in their 30s to 40s. I mean, sometimes, I see men having children or, being a father in their early 40s. So that's one thing that you want to pay attention to, but it doesn't always solve the problem. And that's what I really want men to realize, is that it's not the end all be all, because testosterone, yes, your testosterone levels may be low, but there's a lot of men with low testosterone levels who are functioning perfectly fine. And that's where you have to come into understand the androgen receptors, or the testosterone receptors. It's kind of like thyroid receptors. You might have thyroid hormone there, but the receptors are resistant, similar to testosterone. The receptors can just be completely burnt out and worn out from the poor lifestyle, from being super saturated or being exposed to too much testosterone. So it's not the solution. It's not the end all be all. And when I do with men who are taking testosterone, I support them in terms of making sure that testosterone doesn't turn into estrogen, because estrogen will just have a negative effect. And then they start getting, they start they start crying during movies and like start feeling bad for like, I don't want to be mean, but it happens.
It does.
So you have
and
to
they get
sure.
Man boobs.
Yeah, they do. And they get a little bit more emotional and they get more sensitive, and they get sometimes they can get hot flashes. So you have to be careful with that. So what I do is I make sure that I look at their biochemical pathways, and I do a lot of genomic testing with 23andMe and Opus 23, and I make sure that their pathways and their enzymes are working well. And then I actually tell them, if you want to go this route, before even starting the shots, let's just try some herbs and lifestyle and exercise, because studies have shown that exercise with a few herbs or exercise on alone could increase testosterone levels. But now I'm adding herbs like fenugreek and ashwagandha and DHEA. Usually they don't need to go the testosterone route, because then to reverse it, then you have to go on like Clomid and HCG. It's a lot to handle. So least invasive first. First, do no harm.
Right, because once you're on the testosterone, your testicles definitely shrink. They have to put you on HCG to combat that. But you also you mentioned that it can create infertility in men in their, if they still want to have kids in their 20s and 30s. Testosterone is not the thing you want to give your man.
Right.
Right.
Absolutely. And they did a study last summer on, they tried to do a male contraceptive. So like the male pill, and it was high doses of testosterone and progesterone. And that actually stopped men from being fertile. Mm-hmm. So, but you see this all the time in men who are on testosterone. Like sometimes they'll even shoot blanks and, have decreased semen volume just because they're not making enough semen, and their testicles they turn off. It's like, okay, you're giving me all this testosterone, there's no reason for me to work. And then they shut down. They shut down shop. And then it creates issues later on, because then when you want to get them to work, then they can't work. And I've seen a lot of men that trigger a lot of other issues like thyroid issues. So even when you get them going, they have other issues like thyroid issues. And if the thyroid's not working well, then the testicles can't work well. And then they start worrying about their thyroid, and then that contributes to a lot of the other stress. And now you have more of the psychological aspect of the erectile dysfunction. And then sometimes men think like, I can't be hard unless I have testosterone. And then it's like, all right, well, I'm off to testosterone. And then they think, oh, I need it to be hard. It's a vicious cycle. It certainly is.
So, but if a guy does not want kids, or he's has already had his kids, and he's just noticing that maybe his performance isn't that great, and he may be experiencing some low libido and a combination of having low testosterone levels as well, doing testosterone would be okay.
Yeah. I mean, I don't see it depend obviously.
I mean, in general, it should be
Yeah,
okay.
it's actually pretty safe. It's obviously you need to get the right form. The gels, they don't typically work very well.
Yeah.
A lot of men are now doing the pellets, where they replace those. Usually, I think it's every 6 months to a year.
Right.
That's much safer, a little bit more effective. Pills, I mean, oral pills do not work. Or they do, but they can be toxic. Um, and then the shots, you usually have to go like every week or so, every week or two to your doctor to get a shot. And that can be uncomfortable. But, testosterone is protective against the heart. There really hasn't been, a lot of people are scared about prostate cancer. The connection there has been debunked. It really does not cause prostate cancer. It can be protective. So yeah, testosterone, if that's where you want to go, you have to, obviously you should be screened and see your doctor regularly and make sure it's not going to all these other bad metabolites,
Right.
like the bad
It's not
testosterone,
converting.
right?
To
Like
estrogen.
DHT, estrogen. You don't want to, and it can be costly as well. So there's all those things I really want to keep in mind. But otherwise, if the guy doesn't want to have kids and, he's middle-aged or even younger middle-aged and really has no intentions, I mean, besides the fact that he might bald a little bit sooner or, maybe he'll have a little bit more acne. If he does have acne, that's really not a concern for me. But again, I support them in their whole process.
And also, once you start on testosterone in any form, you do need to have routine blood work to check levels, and hemoglobin and hematocrit platelets can also increase. So though it is good for the heart, vitality, you feel stronger, you can maybe, it could help out if you're working out at the gym or something like that. And you overall, I just think it's, I do prescribe testosterone. But I will say that the shots it's very viscous. It's very thick. So the needle is a little bit larger than usual than you would like a regular vaccine because it has to, because it's a very thick substance. And so it's not, it can be sometimes a little painful because the needle has to be a little bit of a bigger hole for it to fully go in, and having to do it weekly is a pain. And then, but if you also have to be concerned that if you're using it, like, you're right, those creams and the prescription testosterone that you rub on your shoulders or forearms, you also have to be really careful about making sure that you're not touching anyone else, or if you do have kids, because they can definitely, it's absorbable through the skin. And so
absolutely. You
want to be careful about that.
That I've seen that happen, and you have to be very careful. And usually they tell you to do it before bed. But if you're sleeping with somebody else, your partner, right, then you have to put it on, or then you do it in the morning, but then you have to make sure you're not touching anybody throughout the day, or, you have to pay mind to those things. Exactly.
Oh my gosh, this is such good stuff. I totally, I loved it. Was there any last thoughts or anything that we didn't touch upon that you wanted to share?
Any last thoughts? Well, the one thing I just want to say is, with erectile dysfunction, a lot of men are going to search on the internet. I would say avoid those things. I would say avoid these forums that are a bunch of men complaining about their issue with their erectile dysfunction, because it's gonna make you more nervous. It's gonna confuse you a little bit more. I would say try to find somebody that you trust, and a practitioner that you trust, somebody that you can relate to.
Yeah.
And who you can say, okay, I trust what this person's saying. Because if there's too many hands in the kitchen, or too many chefs in the kitchen, it gets a little bit confusing. It can get worrisome. So trust one person, one or two people. A lot of times I work with other urologists or medical doctors, and we collaborate. And try not to worry so much. Try to do more yoga. Try to do more acupuncture. Try to do more exercise. Try to do things that you enjoy, and try to enjoy the process. Really, don't make it a competition. Us men, we want to compete and get everything done, and be the first to finish. Well, this is not where you want to be the first to finish.
Right.
Right. So enjoy the process, I would say. That's the number one thing I would tell guys.
Now, what about the stuff that's sold at gyms? I know that stuff is sold, I guess, for guys who
Yeah.
want to be more muscular. Who are these people that are selling it, and what are they selling?
Well, it's we're talking illegally. A lot of guys in the
Yes,
gym.
yes.
Yeah. So they're selling really different forms of testosterone, enanthate or cypionate, and these are forms that the same forms that you would typically inject, but they're usually not pure. They're usually contaminated or not 100% active, and they don't work very well. And then they're not controlled, so they're not checking their levels, their hematocrit. They're not
Yeah, you're
checking
right.
their
Oh
testosterone
my
levels. They're not
gosh.
checking. Yeah. So these guys' testosterone levels can be through the roof,
Yeah.
and then all of a sudden they have a heart attack or they start noticing chest pains, and it's you have to be very, very careful. I mean, there's things that they sell over the counter, but I don't think those things work very well unless they're illegal, and they're only illegal once the FDA catches them, and then they find out, oh, this actually has testosterone in it or precursor to testosterone in it. And then they're usually on the market for a month and then they're off. But there's guys who are giving shots to people in the gyms and things like that, and you have to be really, really careful of that. A lot of people are doing HGH or growth hormone as well.
Right. Mm-hmm.
That's fun. I mean, you have to, I couldn't. I mean, you don't take a lollipop from a stranger. So that's exactly what you're doing here in a gym. You're taking something that's really attractive and seems like it's going to help you from somebody you have no idea who he is. You need to trust your physician. You need to trust your practitioner because you're going to get in a lot of trouble. And then people come to me when I have to try to reverse everything, and I'm like, geez, you should have just came to me first, and we could have handled this the right way. But now I have to redo all this stuff that this guy messed up. So, yeah, I would stay away from those people.
Yeah, that doesn't sound good because no one's really controlling. I mean, and because you could be at the gym and trying to do all this and like just build some muscle and get some testosterone, but then ultimately, your testicles shrink, you may potentially be, it could be converting to estrogen, and then all of a sudden you get man boobs and you're like, what's going on? And no one's really monitoring anything. It is a controlled substance, FYI.
And yeah, it is. And I would tell all your women listeners, your guy's not going to tell you about this either.
Oh, that's true.
He's not going to tell you.
But also, he would probably have like tons of anger and rage too, right? When you see wouldn't it cause a little bit of that too?
Yeah. I mean, not always. But in some men, if they have a temper, it certainly exacerbates their temper. If they have acne, it makes their acne worse. But you'll see he'll start getting big and he'll get kind of bloated as well.
Oh yeah. I've seen that.
He'll get like
puffy.
Beefy. Yeah, beefy, puffy. You'll see his forehead will get a little bit bigger. His jawline will get a little bit wider. He'll be a little bit hairier. He'll tell you to shave his back a little bit more often. But he's not going to tell you. He won't tell you. And then, unless you ask, because men are very secretive.
They are.
Because he knows, and I know all your women listeners are very health conscious because obviously they listen to you and they trust you and your opinion. And I can imagine that if your listeners are very health conscious and into their health, and then they have a husband, fiance, boyfriend who is taking testosterone, and I can imagine all the times like stop eating those peanut butter and jellies, or you're trying to guide him to be healthier, and then if he were to tell you that he was taking testosterone, I could imagine most of your female listeners would be like, oh my God, what are you doing? Are you crazy? So he knows you're going to react that way. So he's not even going to tell you. He's going to be like, oh yeah, I'm just taking more creatine, or I'm doing these pre-workouts, or I got a trainer or something like that. But trust me, you can't gain that much mass in a few months and start bench pressing 100 more pounds and not be doing something.
And the biggest telltale sign are like very like marble-sized testicles.
Yes,
ladies,
those do not lie.
You need to check out the testicles, because
Yes.
if they're small and your man is like it's like almost overnight that he's growing muscles, or he's just a little bit more agitated than usual,
Yeah.
something's
And
up.
yeah, if you want, reach out to me. I'll teach you how to do a genital exam on a man. It's much easier than on female. But yeah, you'll notice. I could tell right away. You don't even have to palpate. You could just notice right away, like something's
Oh
going on.
yeah. I mean, the guy will notice. Don't guys freak out about that?
Oh
I
yeah.
mean,
Oh yeah. Oh yeah. But they think they make up with it in bigger biceps.
but will they also decreasing the sperm count, and who know, like if the woman wants to get pregnant soon, or
Right. It's going to take time. It'll take them about a year to almost 2 years to reverse all that.
oh my God, is it that long?
Yeah, unless they go on Clomid and HCG, and then they kind of force it to go the opposite way. But then you have to make sure that their sperm are not only abundant but good quality as well.
Yeah,
and then they move
exactly.
also. Lots of factors there. We can go on for days on this. Trust me, I see it all the time.
Wow. Well, listen,
Yeah.
how can people find you? Tell us.
So currently I'm practicing in Connecticut at the Center of Excellence in Bridgeport, Connecticut. They can also, so that's where I'm seeing patients. I do in person and virtual. And you can also find me on Instagram at Dr.Espo, ESPO. That's on Instagram, and that's the same handle on Facebook. And then my website is the same thing, Dr. Espo, DoctoRespo.com. And there's a million different ways of finding me and getting access to me.
Awesome. All right. So thank you so much. I appreciate you. Thank you for being so just open and honest about all of this, because I think that it's really great for women to just know what's up. And if her man needs a little help here and there, then they can either come and see you, or they have some options here. I mean,
Absolutely.
Being able to find some of these supplements would be great. But, like with every supplement, you also want to make sure that you're getting the high quality stuff, and
Right.
Professional grade is preferred.
Absolutely right. Yeah, it's my pleasure. And there's not enough people talking about this. I'm not sure why. A lot of doctors don't want to talk about, or they want to treat all types of people. But I see mostly men. I mean, I do see women as well, because they deal with a lot of other stuff too, urologically. But you really need to understand the man's mind to really understand the man's body, and that's really why I consider myself a men's health expert. I think more people need to be doing this, and I'm really happy that you're you're very, very open, and you're much more knowledgeable than a lot of other practitioners. But I'm grateful that you're bringing more attention to this.
Yeah, thank you so much. I look forward to, I'll definitely send people your way, because sometimes men just want men. You know what I mean?
Exactly.
So they don't want to necessarily want me doing exams at times, and they're just shy about that stuff. So
Yep.
I will definitely be sending them to you. And who knows if New York is an option. That may be something in the future, but
yeah, that's what we're working on. New York is my home. I teach at NYU, and I did my undergrad there, and I live in New York. So who knows? Stay tuned. I might be coming to a neighborhood near you.
Yes. Well, happy to have you back on the show.
Yes, anytime.
And we will talk soon. Well, I hope you enjoyed this conversation with Dr. Ralph Esposito. And to learn more about him and for all the show notes, head on over to margaretromero.com/episode 34. And if you wanted to listen back to previous episodes that I had with him, we were talking about increasing the fertility in a man. And those were at episode 9 and 10. That was a really long interview. So we split it up into 2 separate interviews. So that would be at margaretromero.com/episode 9 and 10. Hope to see you next week and have the most beautiful week.